Supervised injection services are clean and safe spaces where people self-inject pre-obtained drugs under the supervision of a medical staff member. There are also provided sterile injection supplies, education on safer ways to inject, overdose prevention and intervention. There are two types of safe injection sites, pop-up and legal ones. Harm reduction workers have set up unsanctioned pop-up sites following the multiple deaths around the city of Toronto. One of these is at Moss Park, downtown. Over 1,500 people visited the site. These pop-up sites help pave the way for the expedited opening of safe injection sites at The Works at Victoria Street, South Riverdale Community Health Centre on Queen Street East, and Queens West Central Toronto Community Health Centre at Bathurst. Service users will arrive with pre-obtained drugs. The service provides clean injection equipment and information on safer injection practices. After they have self-injected, they are led into a waiting room where they will be observed for negative reactions. They will also receive information and referrals about other health and social supports and services the agency or elsewhere in the community provide.
Opposition to systemic improvement spans from when the Poor Law came into effect during the 1500s to the current shift to a structural approach which considers the environment and the systems that challenge us, versus blaming the person. Harm reduction and safe injection sites are not excluded from societal resistance, but thankfully we are moving towards a radical social work approach that addresses systemic influences on our well-being. For people who land on the more socially conservative spectrum, there can be a not in my backyard attitude. Some of the main concerns about safe injection sites include centralization of illegal drug activity and increased level of crime. There's a fear that open access will feed addiction. There are people who are worried about where their tax payments are going. The harm reduction safe injection site model is proving to be successful. We have enough data now to know that the punitive war on drugs approach has failed. Some of the benefits of safe injection sites include reduces violence, especially against vulnerable groups such as women or trans folk. Healthcare costs are reduced. Taxpayers actually benefit. Decreases crime, lowers the risk of HIV and other disease. Healthcare is available in a non-judgmental setting. And most importantly, safe injection sites reduce the rate of overdoses. Safe injection sites, they provide other crucial resources such as food access, community, counseling, should a service user ask for help, and referrals to other services such as housing, treatment, and other healthcare provision.
Canada first introduced Supervise or safe injection in 2003. The downtown east side of Vancouver was facing a serious problem. The use of opiates was high, and unsafe injection of drugs could be directly linked to a spike in overdose-related deaths, the spread of bloodborne diseases, as well as drug equipment littering the city streets. Insight was introduced as the first legal safe injection site in North America. It is located in the center of the injection drug epidemic. The main focus is reducing harm to the service user. In 2000, Insight had recorded over 270,000 visits. This was an average of 702 visits per day by 5,447 unique users, with 484 overdose interventions. In 2016, just 7 years later, the demand for Insight is even stronger. Insight serviced just under 250,000 visits, with 840 unique users. While the number of visits has decreased, we must take notice of the increase from 484 overdoses in 2009 to 1,781 in 2006. The number of lives saved because of overdose intervention increased 3.5 times. Insight was intended to be a 3-year pilot project, but has been now operating for 14 years, saving countless lives and proving a successful model with noted results. It has saved the healthcare network an estimated $18 million from 2003 to 2008, according to the cost-benefit analysis conducted by the Canadian Medical Association Journal. Beginning in 2016, many North American cities are looking to Insight for guidance with the opiate crisis. This includes representatives and healthcare professionals from Seattle, New York, Toronto, and Ottawa. With a vested interest in public well-being and mental health, it is important to continue to support and push supervised injection in all cities. Insight has proven a benefit service for the user, a positive impact on the community, and a cost-effective way to savings for the government.